Great. Rocco, did you want to do a closing? Great. Well, thank you. That was wonderful, and a great way to get us started. So my first question is general. It is, if you look at all four examples, what are those key conditions for success that enable the reallocation of resources in these non-health sector examples?
So, that's an important question to think about. I think that, there's some things that you need to have at a threshold level to get broad collective action. One is the acknowledgement that there's a problem or an issue, right? So in all of these cases, we had an issue that had been widely recognized and broadly understood. So the lead paint, for example, came right after the Civil Rights Act, and there was a very heavy focus that was given to what's happening to communities that we had just started to help, and what were some of the factors that were inhibiting that. In LA, when the kids can't go out for recess, that gets everyone's attention, and it does galvanize the type of willingness to use resources. And the Clean Air Act is actually quite interesting because although the money was not spent at the federal level, there was a lot of money spent. So the whole auto industry changed how they produced their cars because of California emissions, all that stuff. So a significant amount of money was spent in response to that challenge. And so first is sort of acknowledging the problem. The second is some sense of an agreement about what should be done, right? So you could get energy coalescing around a particular approach or strategy. And then the third is, and it hurts me to say this, I'm an economist, but it's the law, right? And legal authority and people having the ability to create a structure that establishes the incentives. I think that Clean Air Act is instructive as well. California had the Air Quality Resources Board years before we started to see change. It was only when that legal change happened that we saw that. And then the fourth thing, I always have to throw this out because I'm a researcher, is some degree of an evidence base. And so MTO, the Moving to Opportunity, has been quite interesting in that the evidence that has emerged from that has really sparked some interesting discussions at the federal level about changing policy to make it easier for people of lower incomes to move to neighborhoods that have lower levels of poverty. That would never have happened if there hadn't been some research to really be able to articulate the benefits that had been gained. We've been talking about this throughout this roundtable, that the evidence piece to make people understand what the actual level of benefit that can be achieved if we reduce these disparities is something that can create that policy imperative and a willingness to act.
I would add a couple of things that play off in that. When we looked at the example in Los Angeles of reducing the smog, one of the things that the experts who had worked on those regulatory changes and had lived through and studied those changes said was important was the first person who ran the Air Resources Board was a scientist. And so they established firmly for policymakers and for voters that this was an actual scientific problem and there was a scientific way to solve it. And the second person who ran the Air Resources Board was the complete opposite, interestingly, was a communications expert who had essentially been the campaign manager for Jerry Brown. And the idea was once the scientists had established the problem and the solution, now somebody who actually knew how to make change happen within the political system and convince voters had to come in to make the change actually happen. And it was the coalition between those two groups that made it happen. And oftentimes, what we find is that those two groups don't speak to each other or don't work with each other. I have a friend here in DC who works for a nonprofit that lobbies on behalf of scientists, and she goes to scientific conferences and is astonished at how much difficulty most of the scientists apparently have at communicating their ideas to the public. And she's having trouble getting legislators to do anything about these problems because she has to act as the middleman between those two groups, when the best would be if we realized that communicating in simple language our ideas is just as important as having those ideas in the first place. Because if they're not communicated, we can't do anything about it. And we have a professor who we work with at USC who just got back from doing a stint at HUD for the last year. And the other thing that he said when he was interviewed and asked, what do you take away from that experience? His biggest takeaway was, give me the people who will grind it out and try to figure out second best solutions and not just ideological, throwing things out there, highfalutin ideas. Because at the end of the day, politics is a matter of compromise. And so I think oftentimes we throw out these big ideas and we think we have great ideas and then we go, well, there's no political will. Why didn't this get enacted? Well, there are a lot of people in the room who have a lot of different ideas, and in order to get anything done, it's the people who are willing to compromise and to work on the little details to make it happen at the end of the day that get it done. So.
Great, great. I'm going to turn to you all next, so get ready. The other question I had is one of the things that the roundtable is very focused on is applying an equity lens to everything we do. So my question is, what based on these examples, what do the examples say about what is needed to adequately address the equity issues?
So that's an interesting question. I actually think that the 4 cases that we have selected all have an equity lens that you could look at them. MTO is really about how do you put people on a trajectory so that at some point they can be self-sustaining and not self-sufficient and not require assistance. Harlem Children's Zone has the same sort of element to it. I guess my thinking on that is that equity is something that policy often focuses on, and one of the things that I think we need to be mindful about is if you're going to get resources to be shifted, you really have to make a case that there's a general broad-based benefit that is required to build that coalition. There's a reason why the Moving to Opportunity started as a demonstration, and it didn't just roll out as policy because it was needed. We needed to show people sort of this is what the set of benefits could be if we take this to scale, and that shapes the conversation in a pretty significant way. The one example that you might not think of as the equity lens, which is the Clean Air Act, I think actually also has a very significant equity element to it. The worst air was in the neighborhoods that had the least resources. And the folks who were able to buy their way out of the problem, and in LA you couldn't buy your way completely out, but you could buy more of your way out, had less of an issue. And so all of these policies, because place matters actually in the context of these social determinants. Anthony talked about food deserts, and all of these problems, they kind of co-locate in many regards. So if you can address them and start to make progress, in many instances it will necessarily have that equity impact.
Yeah, I've done a lot of writing about inequality myself, and it is a controversial topic. And in a lot of ways, it may be difficult to get folks behind an intervention that is solely designed to address that problem. But the upside of the examples that we've given you, as Raphael mentioned, is that there are co-benefits. And one of the things that public opinion research has showed in recent years is that those co-benefits oftentimes are more important than the initial stated goal in convincing people to back it. So to give just one example, with climate change, you oftentimes can't get people to support it as an environmental issue. But if you mention that it will affect their health through pollution, all of a sudden you get a lot more support for it. Now, that wasn't the initial intention of that intervention, right? But those co-benefits may be even more important in convincing some folks. So I think with a lot of these interventions, one of the things that made them successful, and one of the things we should think about in creating more interventions like it, is that it wasn't just targeted towards inequality, even if that may be the first thing that we cared about, health equity or anything like that. We have to appeal to a broad base by explaining those co-benefits that are good for everyone.
Great. We have some other questions. Terrific. There's a
mic.
Yeah, a mic there. Yeah. Sorry, my eyes are
Thank you. That was terrific. And I was a program officer at the Robert Wood Johnson Foundation who, for the MTO, in terms of adding health variables to the surveys that were being done, and I thought I understood a lot about MTO. But what I'm thinking about this in the redirecting finances area is, I never really realized this, so that the vouchers redirected the financing that was going to the Public Housing Authority for the projects into a self-control decision. Were vouchers not used prior to MTO? Did this signal a big change in the way that funding flowed?
So, no. So the vouchers had existed for about 20 years before MTO started. But what changed with MTO was the location where the vouchers could be used. So it was almost like the same amount of resources, just used in a different way towards different neighborhoods. So if you actually mapped out sort of where voucher resources were being deployed in a city, you would see that the vouchers get used in a small subset of all the areas in the region. Right, and in particular, they don't really get used in more affluent neighborhoods. What MTO did is say, okay, we're going to take that distribution, we're going to shift it, right, and we're going to move people to other places. And so if you look at sort of the distribution of resources, it's actually changed qualitatively. Mm-hmm. And then and then the impacts on people, the idea is that once you benefit, then you don't need the voucher anymore. So it then can be deployed to other people. So once you get to self-sufficiency, now you're actually getting the multiplier effect that you hope to get from the support. And I would just say, thank you for philanthropy for helping with that. The original demonstration was only a 5-year deal, and it wound up going on for, I think, 10 to 15 years because of the support in large part of philanthropic institutions. We probably wouldn't know the child impact if it wasn't for that supplemental support. So it's actually been quite critical to our understanding of how place matters that this partnership did evolve.
Great, thank you. Bob Kaplan?
Thanks.
Oh, could people please say your name and what organization, please?
I'm Bob Kaplan from Stanford University. First of all, thanks, Anthony and Raphael. It was great. And what I want to do is sort of dig into moving to opportunity just a little bit, because having spent the last 5 years in Washington, it's a topic that came up a lot. And if you think about this, in your economist hat, so you have some resources and you want to use these resources to improve health outcome, maybe quality adjusted life years for the community. And you have different opportunities. Would actually housing relocation be where you put your money? And the reason I ask this question is as you know, that actually moving to opportunity had a fairly rough landing in some communities. The argument was, Doug Massey and some sociologists came after it saying big selection effects, effect sizes are pretty small. If you get into the diabetes part, the argument was, well, maybe there's something there, but would be if you really wanted to improve health, is this where you would spend your money, because that effect sizes in the study are small, maybe obesity control in the community is a better way to allocate the resource?
So I think the first thing to remember is that MTO was not designed as a health intervention. right? It was designed to do something else, and the benefits that we've seen, particularly for children, are pretty substantial, right? So in that regard, there has been success. I think what's interesting, and one of the reasons why I think it's useful to talk about these things in this context, is that investments in non-health domains can have ancillary health benefits. And so, when MTO started, nobody was talking about the health aspects, like zero. Right? This was not something that anybody had in mind. And yet we did start to see some benefits in that context. So as we think about ourselves as a community, what's important, I think, is to really remind ourselves that looking beyond just the health domain can actually help us, that we have real allies in these other places, such that investment of non-health resources, right, because MTO, there's no health resources involved in that, can help us succeed in improving population health. And we can debate to the size of the benefits or the size of the impacts, but any positive impact is better than zero. And to the extent that this was a non-health intervention, that we saw health-related benefits, I think should get all of our attention, right? And make us think sort of what other types of things might we be able to advocate for in terms of getting investments that can produce those sorts of benefits as well.
Yeah, I think, just to add to that, I think it comes back a little bit to what we had heard, that, the people who get the most done are the ones who care about the details and about the second best solution, because oftentimes the best health interventions are the ones that aren't targeted toward health. But if we partner with people who are interested in solving other problems, and we work with them, we may have a better chance of getting things through Congress or through City Council or what have you. And just to add one other thing, if we really want to dig into housing, one thing that's a fair criticism, I think, for housing choice vouchers nowadays is the context has shifted again. In a lot of cities, and we know this because we do a lot of housing research, and we've been thinking about how would you do vouchers ideally today if we wanted to do them, just start a new experiment in a city like Los Angeles. We've been thinking about this lately. And one of the things that you have to face now in cities like Los Angeles is that the housing is so expensive, and there's such a shortage of housing units that a lot of people would get those vouchers, look for 90 days, and not be able to find a housing unit in a new neighborhood at all. And so in a lot of cities, that may not be the best use of money anymore. So we have to think about, meeting the policy context as it exists today. So that some cities where there may be enough housing and it's just that folks aren't making enough money to afford it, those are the best cities to use those housing choice vouchers in. In other cities, you may want to work more on the supply side of things and start thinking about ways to encourage development of housing units for people to live in, to go with those housing choice vouchers.
I will say you're wading into sensitive territory here.
Yeah, fair enough.
There's a huge debate on sort of to your question, if you have a fixed amount of resources, what's the best way to deploy it? And there's a lot of debate about, how much should we focus on place and try to affect the places that people live, versus investing in the person specifically in our space. And there's no kind of consensus on that. And Anthony alluded to sort of the geographic variation in what the right answer should be. And that becomes very difficult to articulate as a policy, right? And that's one of the challenges we have in trying to find these solutions.
I would say that's a huge challenge for us in population health, right? All the resources now are not all, most of it is focused on the individual and not so much on the place. And we're trying to make that same shift. It's a great point. We have a couple of other questions, and we have a good 15 minutes, so please, people on the line or on the web, send in your questions, and we have people here in the audience who are lining up, which is terrific. Your name, please?
Michael Bodakin with the National Housing Trust. Good morning, and thanks very much for this presentation. Hello, Raphael. One thing I think, I'm sure you meant to mention, but I just want to make sure we understand it, and it's really to Bob's earlier point. Certainly the early research on MTO was mixed, but the Chetty research and everything that's come out in the last couple of years, the longitudinal generational research seems pretty certain that there were some long-term effects. My question really is for both of you, unlike I think the other areas you've talked about, and you mentioned that MTO did last for about 10 or 15 years, but there is all of this certainly urgency, it seems like, for people to relocate to high, quote, higher opportunity neighborhoods, unquote. MTO is not really on the administration's wish list. I mean, it's not in terms of trying to make it something real. It did require some housing counseling resources. The trust is buying properties in high opportunity neighborhoods and introducing vouchers into those properties. And we would love to have some kind of MTO analog. Just be interested in your feedback.
So I actually I think policy is moving in the MTO space. So the way that, okay, this is going to be a little housing-ish, so just sort of strap in. So the way vouchers work is you have a voucher and you pay 30% of your income, and then the government will fill in up to a maximum rent. Right? That rent is called the fair market rent. That maximum rent is set at the 40th or 45th percentile of all rents in a metro area. All right, so if you live in, say, Washington, you do a survey of all the rents, figure out where the median is, then you go down a bit to 45 or 40, and that's the maximum rent. Well, obviously, if you're at 45, there are going to be some neighborhoods that are just off limits, right? You're not living in upper Wisconsin. You know, there are lots of places you're not going to be able to live, Bethesda, Potomac. So there's a proposal now, and so that was why that was the impetus for MTO, right? We got people locked in these higher poverty, lower cost neighborhoods, and so the things weren't working, the schools weren't good, all that kind of stuff. So there's a proposal now that's actually out for comment to change how the fair market rent is calculated, and to, rather than calculate it at the metro level, to calculate it at a zip code level, right? And with the zip code, you wind up with significantly more variation within a metro about what the fair market rent would be, and the idea is then many neighborhoods will now become available, because a landlord in a high rent neighborhood is not going to participate if the most they can get is the fair market rent at the region, right? But now, if you get a fair market rate in the zip code or your neighborhood, that's going to be attractive to a lot more people. That's called the small area FMR, and it is really patterned and promoted because of the experiences out of MTO. The idea that we need to be much more creative, and that creativity can generate big changes. And so a demonstration of that started when I was at HUD, actually. And now there's a proposal to make it the law of the land. And so this really does represent a pretty significant change that has emerged out of some research and really with the idea that place matters a lot.
Thank you. Terry?
Thank you for your presentation. Terry Allen from the Cuyahoga County Health Department in Greater Cleveland. So I was deeply involved and appreciative of the support and certainly the efficacy of the work around lead poisoning and the impact on communities. Had a huge impact in our community. And one of the concerns we're looking at as we begin to forecast is if you look at the national background rates of lead poisoning, the dilution factor on the place issue is significant, with less than 2%, a percent and a half, essentially, of kids poisoned nationally. If we begin to look at hyperlocal data and the gaps between kids tested, particularly Medicaid children, there's very pronounced disparities that still exist in hyperlocal data, place-based data in many urban areas. The concern being expressed in the community is whether there's an understanding of that opportunity gap that still exists. And you talked, Raphael, and even informally about recently about some of the economic impact and what the value is at closing the gap, let alone on creating a fair opportunity for everyone to be healthy. And so your sense of this, you could look at teen pregnancy, you could look at a range of indicators, and that national number can mask some of the importance of beginning to still close the gap in the eyes of policymakers. Thank you.
So I agree with that completely. An interesting aspect to the lead paint program, and Anthony alluded to this in his comments, is that much of the way federal grant monies are used is left to the discretion of local parties and players. And if the locals don't share the priority that the federal government does, they can just use the money in different ways. And in particular, in this instance, it's a grant program where communities apply, right? So if you don't see it as a priority, you don't apply, you don't get the resources. And so part of our challenge is to the communications function that we discussed as well, to make sure that these issues are understood to be significant and to impose significant costs on communities. And if those gaps can be reduced, that everybody benefits. There's about $100 million a year that's available for basically lead abatement in the home. And communities can get $3 to $5 million grants on an annual basis. And it's my sense that many communities aren't engaged in that space. And so one of our challenges is really to make sure that all the players that need to be in part, this is part of that institutional arrangement function that we were talking about, that the partners all have to be pointed in the same direction and understand that they're sharing a goal that is worth pursuing.
Thank you. George?
George Isham, Senior Fellow at the Health Partners Institute, Minneapolis. So I hope this question isn't too naive, but I'm trying to connect some larger dots. So thinking about the Elizabeth Bradley sort of description of the allocation of resources to social and medical care in the country being out of the normative sort of comparison with other leading countries. And then your statement, Anthony, about the fact that the rich live 10 years longer. And then the educational example in Harlem, where you made the comment toward the end of your example that something to the effect that if every school system in the country could have those resources, but that seems to be out of reach, kind of thing. So I'm trying to connect those kinds of dots. So the examples that you focused on, are they large enough scale to kind of inform how we might influence larger flows, allocation flows in society that might address at scale some of those shortfalls if indeed inadequate funding turns out to be one of the key issues for creating schools that are more effective for all the folks, and I don't know if that's a fact or not. So I'm dealing with a lot of facts. So I wonder if you just comment on this sort of cascade of comments, and feel free to poke holes in the logic of the question and so forth. But I'm very much interested in learning more about the relationship of these examples to the scale of allocation of resources that might be necessary to increase life expectancy in the entire U.S. population by a significant amount, since I think we're about 3 years short of the average in the OECD countries the last time I looked some years ago.
Yeah, that's a very good, all those are good points. I'm not going to poke holes in them because I agree with the general sentiment, which is that none of the interventions we've talked about have been things that would dramatically increase population health on a national scale. Most of them have been targeted to certain cities and certain places. And part of that is because I think population health hasn't been thought of in these terms in voters' minds, in policymakers' minds. They don't think of doing national interventions to address population health. And part of it is because budget resources are strapped for political as well as economic reasons. And so I don't know if we can scale up these sorts of things because of the funding that it requires. But I think that that's one of the reasons why we gave different examples of different types of financing arrangements, is because in an era of tight budgets or lack of political will to expand those budgets, you need to come up with clever ways to do the best you can with the resources that you have. Some of those interventions are more scalable than others. The education one is one where we still do not have great evidence of scalable solutions.
So Anthony,
Yeah, go ahead.
Can I go a slightly different way?
Yeah, sure.
So I actually think 3 of the 4 examples have been scaled, right? The Clean Air Act is a national thing. It worked in Los Angeles. Millions, probably billions of dollars have been spent in support of this. And to this day, it has benefited us, continues to benefit us, and we are continually having conversations about tightening it, strengthening it, improving it to improve health. So I think that one has been at scale. I talked about MTO and the small area FMR. That is another one that, if the regulation goes through, will have gone to scale. Now, I think it's important to make a distinction between going to scale and solving the problem, right? And there's a difference there. So each of these programs is only going to be able to touch a finite number of people because we don't have unlimited resources. But to the extent that it reaches across the entire country and makes progress in as many places as possible, we start to see improvements among the weakest, the poorest performers, and that will actually increase our average, right? So if we start to see these health benefits of the people who are doing the worst and with the lowest life expectancies, the average goes up, right? If you lop off the bottom, everything else will move, and so I think there's progress there. The lead paint also is a scaled type of initiative. Now, it's not a lot, it's not billions of dollars, but every community in the country has access to those resources and can use them. So I think that's a third one. The Harlem Children's Zone, the Obama administration tried to scale it, right? So if you think about the initiatives that happened in the Department of Education that started in the first term, they were explicitly patterned after the model of the Harlem Children's Zone. And the challenge that they found was that the local context mattered so much that the way the program was structured didn't translate into the same benefits in other places, right? So that's a difference in I don't want to call it a failure, but it is the challenge there was not the scalability. It was really the complexity of the program's implementation that hadn't been fully appreciated when it got put in place. So I actually think we did better. You did better than you think in that scaling context.
I was just going to say, it's unusual that Raphael gives a more optimistic answer than I do, so
Take it.
mark that moment, yeah. I'll sit back and have that.
That's great. I think we have 3 more questions, and then we'll have to close it because we have 5 more minutes.
George Flores, California Endowment. Thank you very much for your presentation. I appreciate it a great deal, and we have quite a bit of experience in all of those aspects in California. I just would like to have us step back for a second and take a look at this through an equity lens. Because if you do that, you can see that in each of the scenarios, we could be playing a whack-a-mole game where you solve a problem in one aspect or in one place and a new problem pops up in another. And in fact, that's exactly what we've seen with regard to air pollution in the Los Angeles basin. What ended up resulting was a lot of industrialization east of Los Angeles that pushed it further up toward the mountains. And so you have places in the Inland Empire, Riverside, and San Bernardino now that have tremendous air pollution issues because the trucking industry and the industrialization was moved there away from the immediate Los Angeles area. In terms of schools, the financing in schools couldn't necessarily be successful until there was a statewide change in the way local schools were financed and there was governance done locally. And on your point about local discernment in where priorities should be, and now that has become the law of the land in California, local control funding. And with regard to people's ability to manage their own neighborhoods and live and move to opportunities or changing communities to improve themselves, we've seen tremendous issues around gentrification and neighborhood change and transformation. And opportunism now with Airbnb and people being able to rent their rooms and get lucrative amounts of money that could help them survive and add to their incomes as a solution to perhaps their poverty problems. But until we've stepped back and taken a holistic look at it and realized that as we do environmental changes, as we do school changes, as we do even economic changes, we have to make sure that we're also increasing the capacity of the people in those communities themselves for the agency that they might have, the voice, the leadership, and the capacity for themselves to govern their lives for self-sufficiency at a higher level, because they're having to live and work and operate and succeed in a new environment, whether they stay there or move elsewhere. And absent that investment in people, you'll revert or you'll have a less successful model. And the second one is you can't do environmental change in places and leapfrog over the fact that those places and environments are that way because of bad policies, because of racism, because of discrimination, because of decisions that were made by power structures that are probably still in place in many ways and in many cases. And until those change, you're going to have other places afflicted the same, or in a matter of a generation or two, the same place will go back. So you've got to change the policies and you've got to change the power structure. Back where we began again, if we don't.
Yep. No, I agree with the general sentiment. I would say that one of the reasons that we were very careful when you see the paper about how we wrote up the Harlem Children's Zone, just as an example to your point, is that oftentimes charter schools are very controversial in these neighborhoods, and part of the reason is because they feel that outside foundations are coming in and telling them how to run schools and not asking for the input of the local communities. So we didn't really get into those issues in the paper, but we did throw in some caveats to that effect, that you of course want to take into account what people's actual desires are in these places. So I agree with the general sentiment, yeah.
Great. Last question.
Thank you. Tom Kotke, Medical Director for Wellbeing at Health Partners in Minneapolis. This is probably more amusing around education. If you look at Elizabeth Bradley's diagram, Finland sits right next to the United States in total health and welfare spending. It's about 1 percentage point higher. But their GDP is half of that of the United States. They are not a rich country. But instead of ranking about 20th or 25th in education, they rank 2nd, 3rd, or 4th internationally. And the question is, is there something we can learn from the Finnish experience about education? And maybe there is enough money in the United States for good education, and just maybe look at the Finns and see how they've been able to do this on a shoestring at half of our GDP.
So that would be the next roundtable topic. So, all these policies are, I'm going to say this totally differently. There are a lot of policies that make sense, right? And what communities, what societies need to do is figure out, of the things that make sense, what are we willing to fund and at what levels? And that's the political process that goes on. And you could just look across states, and the variation in the extent that some states are willing to fund certain activities versus others demonstrates that the political process can get us to different places depending on who's involved. So George's comment about who has a voice, whose priorities are heard and understood, who gets to weigh in, all those things shape decisions about the aggregate expenditures on policies. And I think it's really important that we get our voice so that the issues that we think are important and that we think actually are quite significant for improving quality of life and getting our society to a better collective place are understood better, so that they can move higher on the priority list and we can get more resources devoted to that.
I would add one thing about that statistic about what percentage that different countries spend on health that I think is really important for us here, that we all have to think about reframing the way that statistic is used and the way we think about it, because that number doesn't capture what we're sitting here talking about today. That number mostly captures health expenditures that are not social determinants, things that are part of the medical system, and we're trying to talk about social determinants. We have to start thinking about health expenditures as including everything we spend on transportation, on urban planning, on the environment, on all the things that we would list that would look like they're different categories if we broke them down. All these things affect our health. So the amount of money that we're spending on health, whether we like it or not, is actually much higher. We just don't think of it in those terms.
Thank you. I think we have one more question.
Sure, I'll try to keep it brief. Steve Smith, University of Florida. So first of all, thank y'all. That was very interesting. I love hearing this sort of outside perspective of the economist. So I guess sort of as a general question, you all presented several cases, at least pretty much all of which, except for maybe the smog issue in Los Angeles, were really aimed at outcomes other than health, so education or economic improvement. And so it seems to me that we have all these different sectors that are basically trying to achieve the same thing. We call it a different name. It's economic improvement, it's better education, whatever. But we're all trying to essentially increase opportunity for people so that they have better, longer lives. And I'm curious, it seems to me there's a lot of disincentive to be able to overlap those efforts, particularly at the federal government level and maybe at the state level as well. I'm not sure if it's as big of an issue at the sort of local government level, but I'm curious if you all could just comment or sort of give us some food for thought about how we can try to overcome some of those disincentives to align these different fields that are basically trying to do the same thing and sort of act as a force multiplier for actually accomplishing some change that's useful.
Sure. So I'll talk first about the nature of the disincentive, because it's something that has frustrated me for a long time. So at the federal level, one disincentive is that if you use resources, if you're in one department, use resources that create benefits in other departments, you get no credit for it, right? And in fact, that just winds up being fewer resources that come to you, and so your incentive to really partner and collaborate, where some of your housing money might actually be used for a health clinic, is significantly diminished. So if you're going to do that, it's out of your own charitable goodwill. At the local level, because I actually think it's a big problem at the local level, one of the challenges that we have, and I'm actually trying to do some research on this, is that oftentimes the beneficiaries at the local level of incentives are different governmental entities, right? So if I'm the city of Los Angeles, I put up a homeless shelter, the benefits go to the county health system because they're not getting the same number of emergency room visits, right? And I have no way to recapture those benefits, any of them, right? And so our fractured local governmental structure also creates disincentive there. And what's interesting, the places that don't have that disincentive, like the city of San Francisco, which is the city and the county, they do different things because the same people see the budget line items, they have captured the actual benefits, and so they're willing to do it. It's obvious to them that these are things that you should do, and it's all because of how we've set up our local governmental structures, right? And I think that's something that probably hasn't gotten as much focus or attention. Everyone knows about the federal government issue, but the locals is just as significant. So how do you do this? You know, I think this is one of the biggest challenges we have, particularly in the social determinant space, because I'm going to talk like an economist, that's the outsider. Right, what you need is a binding long-term enforcement mechanism, right? Because one of the challenges we have is that, say I'm at the city and Anthony's at the county, we can agree that we're going to transfer money, right? So when the savings happen, he's going to give me some money for the stuff I've spent. But when I get voted out of office or I have my term limit, it's a new person, right? And now you have to reestablish all those commitments and contracts. So it winds up being something, a solution or outcome that is not stable. It's not a stable equilibrium, and it's something that has to be renegotiated continuously. And those sorts of contracts are incredibly difficult to sustain. They're incredibly difficult, and so that we don't see it very often. So what we need is some sort of new contractual structure, or a different contractual structure that locks in. It's almost, actually I'm thinking on the fly now, but it's almost like the difference between opting in versus opting out. And if you could find a structure where you opt into the savings and that communities or parties would actively have to opt out, then you could get something that's more binding. You see this in the 401 space, right? So retirement funds, programs where you actually have to opt in have far lower participation than the ones where you have to opt out. We probably should be thinking about some structures like that to put in place, and I think you could see more of the type of collaboration that we want to have happen.
That was a good idea to come up with on the
Yeah,
fly. I like that.
that was great.
That was good.
That's great. So I'm sad to say that we now need to end. But I really want to thank our wonderful speakers. So thank you very much. And I also hope that, I think the dialogue will help to inform the paper too. So,
Yes, you're very helpful.
yeah, thank you.